ecchymosis, whichever word you want to use. I'll be talking about bruising, ecchymosis, what it is, what it looks like over the next few slides. Now, bruising and ecchymosis is really common. I've got some stats and figures and a couple of pictures to show you. So we'll move on to the next topic now, which is bruising or ecchymosis. It's one of my favourite words in healthcare, ecchymosis, which means bruising. Now, there's been lots of studies looking at bruising following dermal filler treatments, and actually you'll find that bruising is exceptionally common. And some of the research says almost 1 in 5 people bruise, and some of the research says sort of 70% of people bruise. So I tend to pick a number in between, and I tend to go for about 50%. So I tell my clients I think it's about 50-50, and that's kind of from my own anecdotal evidence with my clients. It's either side of that, so that kind of fits well with me. So I tell my clients it's commonly experienced and probably around 50-50 chance of bruising. If you tell your clients there's a 50-50 chance of bruising, it means that they're aware there's a good chance they will bruise. What you can do is try and encourage them to reduce the risks of bruising. So we call this minimizing the risks of bruising. And if you can get them to minimize the risks of bruising, it means they are less likely to bruise when they have the procedures done. Things such as no alcohol for 24 hours prior to the procedure. If they've got certain deficiencies, potentially vitamin C and iron deficiencies, they might bruise a little bit more. Certain medications like aspirin, clopidogrel, clopidogrel, depends how you pronounce it, warfarin, apixaban, those kind of blood thinning medications would make them more likely to bruise. Now, it's not normally our job to stop those blood thinning medications. That's normally, it's not an aesthetic practitioner's job to stop those medications, and they're normally taking those medications because they have a medical reason to do so. In fact, they will have a medical reason to do so. So those clients, it's about saying to them, you're taking warfarin, your blood probably makes you more likely to bruise. It doesn't mean you can't have this procedure done, it just means we need to make you aware that it's more likely for you to have a bruise following the procedure, and choosing the right time with the client to have the procedure done. Other things that might help as well, there's maybe some small evidence that arnica cream might help with bruising. It won't do any harm using arnica cream as well. So if people find it helpful or they've used it before, we can encourage them to use some arnica, for instance, as well. And some people might have heard about pineapple, fresh pineapple as well. If they've used that before and it's helpful, they can go ahead with fresh pineapple for bruising as well. So those kind of things might help. Here's an example of some bruising on the top lip. The bruising looks almost the same colour as the skin, it's slightly dark purple. You can see it's fine, it's not going to cause any major issues. It's obvious the client had something done though, so they're obviously aware of it, but it's not majorly problematic. That's the great thing about bruising. It's not majorly problematic, but the client's not always a big fan of it usually.